Buenos días a todas
Good
y
morning to all
todos.
of you.
Les damos la bienvenida
I
a
want to
esta
welcome you
webinar
to
del
this
Banco
webinar
Interamericano
of
de
the Inter-American
Desarrollo.
Development Bank.
La conversación será en
Our
español.
conversation will be in Spanish.
If you wish to listen in English, you can select English in the interpretation button in your Zoom. Si quiser ouvir em português,
He is repeating into the three languages that you can choose the
If you
language of your
wish to
choice
listen
at
to
the bottom
English,
of
you
the
can
screen.
select
My name is
English.
Marco Stampini, and I work in the Social Protection and Health Division of the Inter-American Development Bank. And I will be chairing this webinar. Today is the International Day of Caregivers, a frequently invisible population. This, despite that in Latin America and the Caribbean, just for the elderly, there are more than 13 million unpaid caregivers and 3 million paid caregivers. To begin, I would like to introduce our speakers for today, which are luxury. They will offer different viewpoints on how to improve the welfare and labor conditions of those who care for the older persons. Beatrice Fabiani de Leva is an economist and main author of the IDB monography on caregivers. Diana Mejia is a Director of Integral Development and Protection of the Older Adult in the National Council of the Aging, CONAPE, in the Dominican Republic. And Elena Zúñiga is the Postgraduate Director in Health of the San Ignacio de Loyola University, founder of the Caregivers School in Peru, and president of the Dependent Caregivers Association, ACUPED. Welcome. Throughout the webinar, we'll invite you to ask questions in the language of your choice using the Q&A button at the bottom of the Zoom. We will select some of these questions to ask at the end of the webinar. Bear in mind that your microphones and cameras have been deactivated. And now we'll begin with Beatrice's presentation. Beatrice, please.
Muchas gracias, Marco.
Thank you, Marco. And good morning to all of you. It is a pleasure to be here today and show you the results of a survey we prepared at the Health and Social Protection Division of the IDB. Survey which tried to discover the labor and welfare conditions of caregivers or older persons in the region. Let me begin by telling you Carmen's story. She is a caregiver from Peru living in Santiago de Chile. She cares for an older adult who has reduced mobility. And she does this work for over 5 years now. She does this quite committed, quite dedicated, and with a great deal of sacrifice. However, the caring job has important consequences to her physical and emotional well-being. Why do we tell this story? Carmen's story is a story of millions of caregivers who care for older adults every day in the region. And yet, what we did at the IDB is that there's lack of knowledge about the well-being, the training, and the labor conditions of caregivers in the region. In order to hear the voice of all these caregivers, we prepared an online survey which is continuous and self-administered, and we did it also with the support of the French Development Agency. The survey was launched in November of 2023 and is still open. In June, we published the first report analyzing the first 27,000 stories of these caregivers. There are paid caregivers at home, there are paid caregivers, and then unpaid caregivers. It is in English, Spanish, and Portuguese, the survey. And we believe that it is a significant effort to hear the voices of so many of these caregivers. And all of you are invited to form part of this effort and help us expand the database. And talking about the profile of these caregivers, 89% of the surveyed are women. And there's a 1% identified as other gender identity. These caregivers are on average 53 years old and have completed their secondary education. As for the diversity component, 11% of them are identified as Afro-descendant and 10% as indigenous. And amongst those surveyed, there's a 6% who are international migrants. And now let's see the key findings. First, to care for is a decision. 59% of the unpaid caregivers or family caregivers do this job because they want to. And they do it because of their own initiative. Likewise, 67% of the paid caregivers choose this profession because they like it. So, to care is a decision, and it brings satisfaction to the caregiver. However, there are important costs in terms of their physical, emotional well-being, and their labor conditions. What we see is that 1 out of every 4 caregivers reports depression, and 1 out of 2 is said to be stressed. These effects are even greater for family caregivers. And what worries us the most is that these levels of stress and depression are higher than the levels of the population in general. Another fundamental aspect is that there's not enough training in the region. 8 out of 10 family caregivers have no type of training. And amongst those who are paid, only 3 out of 10 have completed a course of more than 150 hours. And we know that the recommendation is that the training courses be at least 260 hours. Training is fundamental because what we see from this study is that any type of training is associated to higher income and better levels of well-being. In other words, less stress and less depression amongst the caregivers. And speaking of the working conditions, they're often unsafe and precarious. 70% of the paid caregivers earn minimum salary or less. And these are unsafe working conditions because 39% report having been verbally abused and 15% report having been physically abused. And informality is very high. What we see is that only 1 out of every 4 caregivers contributes to the Social Security. This informality is less for the family caregivers, where there's a 42% who contribute to the Social Security, compared to 23% of the home caregivers. Informality is very high throughout the region, but today I would like to mention the example of Uruguay, having the highest level of formality amongst caregivers. And we see that there's actually no difference if they work in a residence or at home. Just to mention this, that public policies can make a difference. Uruguay is an example of a country that has built their caregiving system for years and has implemented policies and programs for caregivers and for all workers in this sector. If you are caregivers or you are part of caregiver associations of older adults and wish to be part of the survey, you can find the QR code here in English, Spanish, and Portuguese. And also, you can download the publication here. Thank you very much, and I return the floor to you, Marco. Thank you very much, Beatrice, for this presentation. I recall having seen pictures of caregivers from a group in California that has 400,000 registered, just to give you the size of the profession in a country like the United States. And this is a group of only California that had a panel that said "Invisible No More." Their slogan was "Invisible No More." And that's why we decided to have this survey, because we want to give caregivers a voice. We know that their well-being, their professional training, their professionalization, their recognition is fundamental for the well-being of the older adults they care for. So now I'd like to ask Diana a question. Diana, I know that in the Dominican Republic, you've implemented a program called Families of Love, Familias de Cariño, to improve the quality of life of the unpaid caregivers of older adults. Can you tell us a bit about this program? How were these people before the implementation of this program, and what's the result of the program? Thank you. Well, first of all, thank you for this opportunity. And of course, I'd like to tell you a bit about Familias de Cariño, Families of Love. Since 2021, the government of the President Luis Abinader implemented this program with one objective in mind and a tripartite approach, establishing that the care of the older adult is a responsibility of the family, the community, and the state, which means that every actor involved in caring must ensure the protection of the rights of the older adult. This is by Law 352 and 298 on the protection of the aging. So this Familias de Cariño has this vision in mind to keep them in the family environment and or the community, which means that there must be a recognition of the family members or persons in the community who have traditionally cared for the older adults in an unpaid fashion. This program seeks to identify these families in the different sectors where the older adults live, who require this care, but with special attention given to those homes, those places that have women alone who can care for the older adult, or these older adult homes, or who are retired or unemployed. So they turn these homes into houses of care, and the government transfers an economic cash to care for these older adults. To apply this modality, we to reduce the institutionalization of the older adult, training the caregivers so that they care for them at home, including their care comprehensively and in other services that can allow for this care to be done in a more effective manner. In other words, with cash transfers, economic recognition, and contribute to economically strengthen those who are caring. We base this on 4 criteria. A caregiver can either go to the home of the older adult, or they can come to her home because they are family members, and they can care for at least 3 older adults. Obviously, when they care for more than one, the economic compensation is greater. Currently, there is a cash transfer of 50,000 pesos, which is equivalent to $249 on average. This program began with 5,000 pesos, with only 3 caregivers, with $83. And we've been increasing it progressively from 2021 to date. Currently, with 290 caregivers, with any of the modalities I described, where the highest percentage is in the family environment. 56 of them are family members caring for the older adults. And here I'd like to show you some images of a partnership that we've established in 2023 with the National Federation of Working Women, FENAMUTRA, which is a union organization and social organization defending the rights of workers in the Dominican Republic in the domestic and caregiving sector. The purpose of this partnership is to exchange experience, knowledge, and training on aspects related to care to facilitate the institutional strengthening for comprehensive care, particularly in the home environment. And as we see here, this training is done in the main headquarters of Penamutra, which is a training center supported by the Technical and Professional Training Center, INPOPEC. And we can certify these caregivers who've been doing the work in their community and have not been recognized as such until this Familias de Cariño program was developed. There are still challenges in the program to add them into the Social Security system, but we're working on that with other working plans. And finally, in December, this is something we began last year and continue this year together with Penamutra, we had a festive Christmas activity for all caregivers that participate in the program of Familia de Cariño. And for the first time, they will be receiving their training certificate. Thank you. Thank you very much, Diana. I believe that it's important to underscore the fact that this is not a program which is only cash transfer. It recognizes the work of the care, but it's much more than that. It includes a contract. It includes possibly participation in the Social Security system, support, and training. So it's with the spirit of what other countries call cash for care or cash for counseling. So thank you very much, Diana. Let's hear from Elena, and who's going to talk to us from Peru and the private sector. Elena, I know that in Peru, you've created a Caregivers Association for Dependents. Why did you create this association, and what are you working on at this time? Thank you for this invitation, my dear Marco, and the Inter-American Development Bank for this opportunity to act as the voice of many caregivers in my country. The Caregivers of Dependent Persons in Association is a nonprofit organization, ACUPEC, seeking to make the voice of the caregivers of older adults more visible and heard, the paid as well as unpaid caregivers. Our mission includes, for example, actions to protect and defend the rights and strengthen the knowledge of caregiving free of stereotypes. To tell you about the origin of this initiative, I'd have to mention that in my country, recognizing the work of formal and informal caregiving is still a constant struggle for those who provide the service. And as in other countries in Latin America, as Beatrice said, it is a feminized activity. Just to give you some examples, in the case of the nursing professionals, in 2002, they published the labor law regulating the professional practice of this, and yet the recognition and the insurance of a decent and equitable job is still pending in many of these. Likewise, in the case of the caregivers, in 2020, Peru approved a law for the caregivers at home. And in this law, they include the caregivers of older adults and dependent persons. In this framework, they establish a minimum salary, amongst other things, for a 48-hour-a-week job. So the work of the caregiver and the home caregiver is one of the most underestimated and poorly paid jobs in the country. The disinformation of the true role of the caregiver and the job of these, who speak of the fact that a caregiver could do many other domestic activities, endangers the quality of care they require and has promoted an increased informality. In this context, ACUPEC is developed to make society aware of the true role of the caregivers and their impact, the recognition of their work, and the care of older adults and dependent persons. It also seeks to develop some actions that we have been carrying out with the support of some strategic partners, nationally and international partners, such as the dissemination and awareness campaigns in the national media, workshops to strengthen the soft skills, workshops for understanding how the care worker can cost his services and establish a fair pay. We also have legal schools for the caregiver where we talk about the normative framework that governs their activity strategies for the design of a curriculum and how to develop and how to act at an interview, for example. We also want to reach many other regions in the country, but it's a tremendous challenge, and which is the digital literacy of caregivers, which is another action that ACUPEC is taking. And I'd like to show some of the images that complement my response. Here you see the first day we launched ACUPEC as part of a 9-year activity for the as a private organization to train the caregivers. Many of those graduates asked to be represented through some kind of association, and it was in June of this year that we launched ACOPED. As you see, it is in one of the municipalities in the city of Lima, where more than 100 caregivers were present. And we can see an interview here in the National Radio in Peru where we speak of caregiving of the older adult and how it's important to recognize their role. And finally, some slides on the persons who work with us from Mexico, Peru, people who work in human resources and in law nationally and contribute with us to strengthen and train more caregivers. Thank you very much. Thank you very much, Elena. I believe that everything you said would deserve a long conversation, beginning by the role, beginning by the fact that the national policies and the fact that the municipalities play a key role in implementing these programs, and the question of the digital literacy of the caregivers, since access to training digitally could allow them to work and train simultaneously. And there are many examples in other countries of training which are practically all online except for the training at work. So how you speak of the work that is done to improve the well-being of the paid caregivers. And because of that, I'd like to ask Diana a question. Because Diana, aside from working with the familias de unpaid caregivers in the Dominican Republic, you've done a very important activity professionalizing the paid caregivers. Particularly, there are many caregivers who are working under different types of contracts, one of them being the work that you did with the people who were hired in these permanent residencies, acting as caregivers, but with the job as janitors. How did you work with these people? How did you help them to be recognized as professional caregivers? Yes, thank you very much. We, in 2015, through a Decree 8715, received a transfer of what was the direction of the protection of the aging, which was under the Public Health Ministry, and it was transferred to CONAPE. And amongst that included the activity of the residencies of older adults and the daycare for older adults. When we received these and became responsible for all these services, we began to organize and automate all the services in these centers, particularly in the human resource aspect, and identified that there were a group of people who were supporting the nursing auxiliaries and the nursing staff doing caregiving activities in a pretty basic profile, like cleaning the people, keeping them clean to avoid complications, managing and controlling the medications, keeping them company, supporting them in the different activities where the older adult could not do it for himself, and to make sure that they ate appropriately, and other complementary activities that were assigned to them by the auxiliary nurse or the nurse. So when we saw this, and we saw the job description of the janitor, which was the domestic activities of the place, we were able to identify that we had to decide on a job description and present it to the public sector for CONAPE. And in 2016, a year later, we were able to describe the jobs for the aging with the caregiving job in general services with the category of simplified status. What it means is that simplified status is that the uh, jobs done by the occupational groups 1 and 2, though are not subject to administrative careers, do count on with the rights of the administrative career. They're hired permanently in the Dominican state, and they have access to all the social security rights, vacations, permissions in a safe manner and with guaranteed rights. So we have this job already described. It's under the supervision of the health department, of the nurses or nurse auxiliaries, and it is as a prerequisite for the job. Their training had to be up to second grade, second year secondary school. This was the same women who were acting as janitors at the time. They required experience or other basic knowledge about pediatric care, and they had a 3 months practice care. They were checked to make sure that they were cared for, they were clean, and they had to report on the situation of the older adult. And finally, they must have, they must be committed to the results, they must be responsible, they must be able to communicate and develop personal relations. Also, there were other types of materials that they required to practice their activities. And currently, we have 30 people who are under this caregiving job description who are mostly in the residential sectors in long-term stay. Obviously, aside from the caregiving staff, we have the nurse auxiliaries and nurses in these residential centers. This was recognized in 2016, a year after they were transferred to our group. But in 2021, we were actually able to set up the basic profile of the caregiver for the public sector with a salary slightly above. We have a category, which is that of the public sector, with a minimum salary, which is $166, 10,000 pesos. But these caregivers, their minimum is 15,000, just like the family of care. And the maximum is 25,000, which is $415. So most of these caregivers are already receiving medium or maximum salary and have access to continuous training through the National Council for Aging. Thank you, Diana. I wanted to highlight one of the things that you mentioned, which was the definition of the professional profile and how important it is to define that profile. In many countries of the region, there are people working as caregivers who are nurses or nurses' assistants, and others who work as caregivers employed by the home or as janitors. And there's no in-between definition of the professional role of the caregiver. And that's very important because it also allows us to collect the data. The caregivers are mixed into other categories. And if this is so, we're not able to know what their condition is, nor can we improve their perspectives or their future. Thank you for that description and this contribution. And we're going to go back to Elena now. Elena, what are the challenges that the training school and the Caregivers Association of these caregivers of dependent persons have as a private organization in the current context of the caregiving sector in Peru?
Thanks, Marco. To answer that question, it should be noted that in the current context of the care sector in Peru, some initiatives have been presented. One is the implementation of a comprehensive care system presented by the Ministry of Women and Vulnerable Populations. This was in 2022, and the idea was to have a comprehensive structure involving government, the market, families, and civil society in care. I was able to take part and collaborate as a consultant to see how we could improve the conditions for caregivers in addition to fostering their training. But despite all of the efforts, the proposal was archived earlier this year. Also, the home workers' law is not always enforced. So many caregivers are left unprotected with regard to their labor rights. In 2023, less than half of the workers were formalized in the home care and domestic work sectors. Very few people in Peru report formal caregiving contracts. And as long as this situation continues, the demand for care continues to grow. We have nearly 5 million older persons in Peru, and 88% of them have at least some health problem. So these are some of the situations that pose major challenges for us to continue to work to improve the care sector, especially considering the life quality of caregivers and also of older persons and dependent persons. We think that one of our great challenges is to raise the visibility of the role of caregivers, considering also the full recognition of the rights. And our goal is also to train and empower caregivers, in addition to breaking the barriers of ignorance, as well as a digital gap, trying to also break stereotypes. Another great challenge is to publicize our initiative nationally. We want to continue to raise awareness in the population regarding the negative consequences of the current division of labor and also the consequences of informal job markets. I would like to also provide some images here. As I mentioned, we have major challenges, but we have made progress with some actions in the field of caregiver training. And we foster an interaction between caregivers and older persons through activities, as you can see, that will enhance care and also help older persons become more resilient. The workshops we run are collaborative and aim at comprehensive caregiver training, also including self-care elements. And the picture below shows one of the latest alliances we have forged with the Lima Welfare Society. Thank you very much, Elena, for telling us about these very significant experiences. I would like to now turn it over to Beatrice, who will talk about an experience in Italy that I think is very interesting and inspiring, as it's been replicated in other countries. Italy has been able to almost fully formalize a sector that had previously been highly informal through the work of an association of employers of domestic workers, and also on the basis of a single national contract for people working domestically. Can you tell us about the initiative and about the additional work that's been done to raise the visibility of the sector through an observatory? Yes, Domina in Italy has done valuable work, and I would like to note 3 points. First, formalization. The second one is the cultural change, and the next one is the work with data. Formalization, because the work done by Domina regulates the system for hiring and managing domestic work relations. This work has been done for the last 30 years, and for the first time, the labor relations of the sector have been regulated in 2023 through a collective bargain agreement. And in 2023, over 386,000 caregivers have been formalized. We know that there's a large share of women in care work, 86% are women. And in Italy, there are also many international migrants who work as caregivers for older persons. In fact, 72% in the Italian case. So this is basically the sort of work that Domina has been doing for many years already. And the second point has to do with a culture change, because Domina works directly with families to train and formalize caregivers. And this involves a cultural change, as it has to do with educating and guiding families when it comes to hiring, also identifying the gaps when it comes to certain formal steps, and what other things need to be done to formalize the sector's workers. This is a culture change that doesn't happen only within households, but that permeates all of society. So this is why in parallel, Domina has a data observatory, and every year they publish a report on the situation of domestic workers, and they provide very detailed statistics. And this is vital as it lays the foundations for putting in place policies for the sector's workers and also to influence public opinion. So I'd say that Domina's work in Italy is holistic in that it encompasses all three dimensions, and the Domina example is also spreading elsewhere in Europe precisely because it's a kind of work that can be replicated in other countries. Thank you. Thank you very much, Beatrice. And now to provide some elements. The contract is a single format contract, but not for just one kind of work. So a caregiver for older persons can also be hired to work with people who are dependent or not dependent, and those people they care for may live, and the caregivers may live in the homes or not, and the salary will also depend on whether the person has received training or not. So although there's a single format, you can customize the contract depending on each case. Now back to Diana. Can you tell us what next steps you are working on to improve the well-being of paid and unpaid care workers in the Dominican Republic through your communities of care program? Absolutely. Following Executive Order 33721 issued in 2021, we started working on the communities of care, which prioritize care for vulnerable populations and people who are dependent, older persons, children, and people with disabilities. There's an intersectoral care board headed by the Ministry of Economy, Planning and Development, the Ministry of Women, the Superate program, and other institutions. And we developed this national policy on care to have a national care system with a focus on dependent persons and vulnerable persons. Against this backdrop, we are focusing on care as an opportunity for the private market and sector. And we have launched a different process with a group of people, a group of women caregivers who went through a training program, and they started working with people in the Superate program that focuses on households with certain economic vulnerability. And this includes a training program as well as an employability and soft skills talk provided by Superate, in addition to some tests and the preparation of a CV for them to have. And after that, they move on to a 200-hour training program specializing in older persons. This is more specialized. And they then go through an awareness raising program for training with the social familial support component. They then move on to practice sessions at care centers, old people's homes, or at the homes of older persons who need care. And this is coupled with supervision that is carried out by members of the programs. And at the end of this, they also get 200 hours of practice, and this also includes a certification, which also includes different levels of training. And there's online training. Once they have gone through all this, they are given a recognition, a certification, and authorization to work with older persons in homes. We are also now licensing the first 90 caregivers of community of care, which with the license they get, they can make themselves available to provide service. And this is actually provided for in the law, which mandates the organization and design of a system regulating the sector of care. And the caregivers have a different profile because we give them extra knowledge, such as some mobilization techniques, how to make sure that they can also foster the social, cognitive development and inclusion of older persons, also helping them to monitor the health condition of patients, which can provide valuable information for healthcare professionals. And on the basis of this, a care plan can be developed. So this is a higher level of training, and it includes other aspects of care that had not been considered previously. And also, there's a record that can list information and a sort of a care protocol, and also be helpful in cases of emergencies. Of course, the salary is also taken into account. It is $365 or 23,000 pesos, and the wage they get is higher than the approved public sector wage. Thank you, Diana. It's very interesting to see how the DR is also working on this program that includes a care system to also take into account the fact that in poor families there are needs of care for the older persons. And very often, if you don't deal with the care burden, it's very hard for many families to be lifted out of poverty, as they can't go out to work if they're overburdened by care duties. And now, I would like to go back to Elena for our Q&A. Elena, where does the region stand compared to other high revenue countries? There have been campaigns and associations working to provide a contract to enhance social security, to raise wages above the minimum wage level, also measures to prevent burnout. A lot of battles have been fought in the past 40 years, and the LAC region is starting to work on many of these things only now. So where does the region stand, and what are the next steps you would like to see as part of your work? Yes, Marco, you said so. These are battles, these are struggles. We've been talking about care in Latin America for the last 50 years, but many of the public policies are not yet materialized in a way as to protect caregivers. Many organizations in Latin America, like the IDB, have developed studies that describe the type of training that caregivers receive in America, and also including the features of the programs. One of the factors that I would highlight is that until 2020, there was a demand for 4.8 million caregivers. And some countries, especially high-income countries, have programs that offer more than 200 hours. But in Latin America, many of the programs may have 60 to 90 hours. In our experience, as a school for caregivers, the professionalization pathways have mainly focused first on the caregiver recognizing their own skills. It is expected that the first contact with the caregiver at the beginning of the program will help them embrace their vocation and actually embark on the whole training process, which also helps boost their self-esteem and self-care. We also provide digital literacy skills to some of the caregivers, and there's also an educational platform embedded in the program. And also considering their previous training background, age, and experience, we design contents and teaching strategies that will help them understand the person-centered care model. We then move on to a second stage that will enable caregivers to have direct contact with older, vulnerable persons. And this has to do with the second question. We have these strategic alliances that help generate this interaction and achieve educational goals through training in real-life settings. The Caregivers School has also engaged with municipalities and some public and private institutions so as to not just enable the interaction between caregivers and older persons, but also this makes it possible to certify the labor skills. We, as a private institution, have a certification that is recognized by the Ministry of Labor, so we can certify the labor skills of caregivers. And this will allow them to work anywhere in Peru. Although we have a pioneering, dedicated program for caregivers in Peru, there have been challenges because we're aware of the labor conditions that our caregivers are in. And of course, there are their own direct responsibilities as mothers, daughters, and wives. Compared to high-income countries, the number of hours should increase in Latin American programs, and we should also diversify the study pathways. However, in spite of the many challenges, we've been on this path for 9 years, and over 4,000 caregivers were able to celebrate having been certified as caregivers. This keeps us going and fills us with pride. We intend to continue to spread our proposal to other parts of Peru, because despite the many years talking about care needs in Latin America, governments and societies fail to see many of these things. I would like to show you a few pictures, and I would like to pay tribute to all caregivers in Peru and in Latin America who are listening now. I think these two pictures are very important. One of them reflects the interaction, the joy and happiness of caregivers. Many of these women choose to give care because they like to do so, and they choose this career. And in the second picture, we see the smiles of all these women who are happy to have achieved a goal that has to do with self-fulfillment. Even though it may not be the number of hours we aim at, they feel they have been trained and are prepared to provide care. Thank you. Thank you, Elena. I think we can now put all of our panelists on the screen as we are now going to turn to the Q&A, including questions from our webinar participants. And of course, more than one of you can answer the questions, but I'm going to direct the questions so as to try and more or less distribute them. Diego Guillar, Regional Director for the Americas of Alzheimer's Disease International, asks how stigma in the care given to older persons what influence does that have, especially in the case of people with dementia, And the question is, how do you work to include dementia and cognitive deterioration so that caregivers can be empowered and thereby be able to handle these situations without being overburdened?
No sé, Elena, estás en la pantalla, tú que eres
Elena, would you like to start
con esta pregunta?
Sí, Marco,
addressing this question?
nuestra experiencia y gracias por la pregunta,
In
Albert.
our experience, and thanks for the question, Diego,
Nosotros partimos primero
we first
por formar a las cuidadoras,
train
eliminando todo
the
tipo de
caregivers,
estereotipo, incluyendo
removing any
estereotipos.
stereotypes,
Luego pasamos
including
a
ageism.
ver,
We
las
then
necesidades o analizar las
move on
necesidades de una
to
persona
look at
que pueda
the
presentar
needs
algún tipo de demencia.
of individuals who may exhibit
Vamos
some
trabajando
form
por
of dementia.
eliminación de
And
los
then
estigmas.
we
Si
work
bien es
on
cierto, es un trabajo más
removing the
complejo.
stigma.
Nosotros
Although it
hemos
is more
podido
complex
desarrollar
work, no doubt, we have been
programas de
able
manera
to develop
diferenciada
some
porque la cantidad de horas
programs
que
in a
tenemos en el
differentiated
programa de
fashion because
cuidador
the
no
number
podríamos
of hours
lograr
we have
esta meta,
in
este
the
objetivo de
program
eliminar
could not
estigmas y de
possibly
poder atender de manera
manage to
personalizada y correcta
remove the
a un
stigma
paciente que
and
presenta
offer
es otro,
personalized
también es otro de nuestros
uh,
grandes proyectos, el poder
care
integrar
for
programas
a dementia
especializados
patient.
con la
Another
formación
goal
correcta
is
para
to
que
have
nuestros
specialized
cuidadores puedan eliminar
programs
ese tipo de
that
estigmas
offer
y puedan
appropriate
atender las
training so that our
necesidades
caregivers
que
can also
presenta un
deal with the
paciente con
stigma
este tipo
and
de demencia.
also address the needs
Diana,
of
quiero pasarte la
patients suffering
pregunta
from
siempre
dementia.
para hablar de estigma,
And
quiero
Diana,
ampliarlo al estigma también,
we talked about
quiero
stigma.
ampliarlo a otros temas de estereotipo, ¿no? De estigma. El estereotipo que la
There's
persona
the
cuidadora sea
stereotypes,
mujer,
right?
por ejemplo.
For example, that
Nosotros
caregivers
hemos
are women.
elegido un título
We
que
have
hace
chosen
hincapié en el hecho que
a
90% de las personas
title
cuidadoras
that
en este momento
stresses
son
the fact that
mujeres, pero no es
90%
que
of
queramos
caregivers
decir
at
que
the
siempre
moment
tiene
are
que
women.
ser así.
But we
Entonces,
don't
si me
mean that
puedes
it's
contar
always
un
got to
poco
be that
cómo es
way.
la situación
Can you tell us a
del
bit about
género de
the
las personas
situation
cuidadoras en República
regarding
Dominicana y
gender
si tienen
when it comes
alguna
to
iniciativa que
caregivers
están
in the
haciendo para
DR? And
involucrar
have you got any
a más
initiatives to
hombres en este
engage more
tipo de trabajo?
men in this kind of work?
Sí, bueno, nosotros hemos venido analizando la
Yes,
situación
we've been
del caso
examining
de
the
las
situation
cuidadoras del programa, por ejemplo, de Familias
of
Padres
women
Caribe, y hemos
caregivers
visto que en 4 años,
in the
efectivamente,
Families
iniciamos con un
of Love program.
96% que eran
And we started
mujeres
off with
y que hoy
96%
en
women.
día ya
And
ese
today,
porcentaje es de
the percentage
86%,
is
incorporándose hombres
86%.
en las
So
modalidades de cuidado.
men have
Pero sobre
also
todo esto
joined
más en
care
la
work.
parte cuando son familiares, un
And
hijo, un esposo,
especially
así.
when
En el
you are
caso
looking at
de
relatives, a
parte del
son,
sector
a
público,
husband, and so on.
también el mayor
On the
porcentaje,
public sector
90% son
side,
mujeres, pero
most
cuando hay mayor
90% are
especialización
women,
como
but when there is a
enfermería,
higher degree
hay
of
hombres
specialization like
incorporados,
nursing,
pues
there
un
are
buen
also men.
porcentaje, ha ido
And you see an
aumentando.
interesting share, and that's been
En el
increasing.
tema de comunidades de cuidado, pues igual,
And in communities of care,
90%
it's the
son
same
mujeres.
thing.
Sí
92% are
hemos
women.
identificado que a
We
medida que hemos
have
profesionalizado e
identified the fact that
incorporado
as
esto
we
como
offer
con un salario
professionalization
social y
and
visibilizándolo,
we
pues se
work
han ido
on
incorporando
the
hombres.
salary side of
Claro, queda
things and
todavía
on
toda
visibility,
esta
more men
vía de la
join in.
comunicación
Of
del área
course,
de cultura
this
con respecto a
requires
este tipo
a
de trabajos,
strategy in
sobre
the
todo
field
porque
of
funciona
communication and
pues
a
en
culture
los
change.
sectores tradicionales de
Because, of
cuidados como la
course,
enfermería,
there are
y
traditional
hay que
care
llevarlo más al
sectors like
terreno de los
nursing,
cuidados
and
ya
there
personales o
is the more
domiciliarios.
personal or household
Efectivamente,
care that we
República
also need
Dominicana
to
pues
work
también
on.
tiene
And
este tema
in the
de
Dominican Republic,
el
we
mayor
also
porcentaje de
see
personas
that
cuidando son
most
mujeres,
of
pero
the
han ido
caregivers are women.
evolucionando en función de los
But there has
recursos
been an
aportados
evolution
y de
through the
involucramiento
resources
de toda la
contributed
comunidad con
and the
respecto al
engagement
tema
of
del
the
cuidado
whole
de los adultos
community
mayores.
in care for older
Diana, para
persons.
regresar a la pregunta
And
anterior sobre los
Diana,
casos de
going back
deterioro
to the
cognitivo, ¿hay un trabajo
previous
específico
question
que
on
hacen
cognitive
para estas
deterioration, do you do any
situaciones?
specific work for
Sí,
such
ahí lo que hemos
situations?
podido aportar es
Yes, what
en
we
dos
have been
sentidos.
able
Por ejemplo, el
to
tema del
do
diagnóstico y la
has
rehabilitación
been in two
del
fields. There's the
deterioro
diagnosis
cognitivo. Tenemos
and
una
recognition of
herramienta
cognitive
denominada que
deterioration, of
enviamos,
course.
expediente
We
de
have
desarrollo integral al adulto mayor, con el
a
cual valoramos
special
situaciones de
tool
dependencia
that helps
funcional,
us
de
evaluate
autonomía,
functional
el tema
dependency
del deterioro cognitivo,
situations, so the
fragilidad y
degree of
soledad o
autonomy
depresión
and
pediátrica.
cognitive
Estas
deterioration,
informaciones se le
fragility,
pueden
loneliness,
proporcionar al
among
cuidador y
other
al mismo
details that
tiempo
can
nos
then be
permite hacer el
provided to
diseño de la
caregivers. And this
capacitación
helps us
continua para dar soporte y apoyo a
develop
estos cuidadores. De
ongoing training to support the caregivers. In the case of families of care, we offer ongoing training virtually, also adapting to the schedules and availability hours of caregivers, even by offering opportunities on Saturdays. And we also offer transport, food, so as to encourage training opportunities. And when there's a higher demand, for example, in the field of deterioration, some support is needed, for example, more of a rotation in the caregivers, especially when you are looking at home-based care. Because if they're in an institution, of course, the law covers this kind of situation. A question for Beatrice. We are asked by Cristina Lopez. What about older persons that care for older persons? The study also shows women caring for women. What does the study you presented show about age and gender, if you wish, the gender relations between the caregiver and person cared for? Yes, I would say that generally, these are not stories of older persons caring for older persons. The caregivers are on average 53 years old. And what we see within family care, as you mentioned, is daughters caring for their mums. And if you look at official data from time use surveys or labor force, workforce surveys, caregivers are on average 42 years old in the case of family caregivers and 46% in the case of paid workers. And this is in line with OECD countries where caregivers for older persons are 45 years old on average. So we are not talking about older persons caring for older persons. I think this would apply more to Asia. There are more cases of older persons caring for older persons. But in our survey, and also based on the region's evidence, we are looking at women providing care to women. Thank you. This has been a highly interesting conversation and a very important one on an issue that is key to the well-being of people with certain dependency situation, also for the families that provide care to them. The families in a region that is aging rapidly and where the demand for this kind of care will continue to rise. And care may also be an economic development engine and also a driver for the creation of decent formal work. I would like to thank you. It's been an honor to have Diana, Elena, and Beatrice with us. The scope of their contributions on the public and private sectors, the studies have been amazing. I would also like to thank the Argentine Clinical and Health Effectors Institute that has helped us survey data. The first 27,000 answers have been presented, but we're already at 42,000. We want to give more of a voice to caregivers, and we hope that voice will be an opportunity to showcase areas of potential work with governance to improve the care sector. Thanks also to everyone who's worked for the organization of this webinar, and especially Milagros and Arumi. Remember, you can download the monograph in Spanish, English, or Portuguese using the QR that is on the screen. And in a few days' time, you'll also be able to access the recording of the seminar dealing with or as part of the cycle of long-term care at the IDB. Thank you very much. We're sharing that on the chat. Thanks to you all, and see you soon.